Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute drug and its intoxication. So we start with the drug that is phencyclidine. So phencyclidine in short is known as the PCP. So this is a class of the hallucinogen. And what are the clinical features? It can include the tachycardia, it includes the hypertension. There is also the ataxia, there is presence of hallucination. Next is a violent behavior is seen, violence, and there's dissociation. There's amnesia as well as the presence of the nystagmus. Next is we move on to the LSD. LSD is also a class of the hallucinogens, and it also presents with the tachycardia. There is presence of hypertension, there is ataxia, there is visual hallucinations important, and then there is also the euphoria and the dysphoric or panic is seen. This is in terms of the LSD. Next we move on to the cocaine. So here in cocaine, what do we have? So in cocaine, it is nothing but a stimulant. Is cocaine. And what are the clinical features? The clinical features is there is presence of tachycardia, there is hypertension, there is agitation. So agitation, then comes the presence of the euphoria. Agitation, there is euphoria, there is chest pain, and there is also the presence of the seizures and the mydriasis. Next we move on to the methylamphetamine. So methylamphetamine, it is nothing but a stimulant, and what do we have? There is a tachycardia, there is hypertension, there will be violent behavior. Next is presence of the psychosis. There is psychosis, there is diphoresis, then comes the coriform and coriform movements. Next is the presence of tooth decay. Now we look at the marijuana. So in terms of marijuana, we look at the THC as well as the cannabis. So this comes under the class of the psychoactives. So it is nothing but the psychoactive class. And what will be the clinical features here? The clinical features is it includes the increased appetite. So there will be very increase in appetite. So appetite is rapidly increased. Then comes the presence of the euphoria. So marijuana, there is increase in appetite, there is euphoria, then there is also the dysphoria. There is euphoria, there is dysphoria, there is panic. There will be impaired time perception. So time perception will be impaired, and there will be presence of the dry mouth. There is presence of dry mouth and also the conjunctival injection. Next is we look at the heroin. So heroin is nothing but an opioid, and it presents with euphoria. So there is presence of euphoria. There will be depressed mental status, DMS, and there is also presence of the meiosis. Next is the respiratory depression and the presence of constipation. To learn and grow daily like this, please do subscribe.